There are moments in life that stick out in the Rolodex of our memories. They may be catalysts for big changes or experiences that leave an indelible mark no matter how small they seemed at the time. It's these moments that serve as bookmarks when looking back on our lives. For Dr. Kara Zivin, the movie reel of her life snags on a snowy night in 2011. 8 months pregnant with her son, Zivin changed into her pajamas, brushed her teeth, then Googled which medications are safe for a fetus. She ended her bedtime routine by swallowing handfuls of various prescription drugs. Hours later, she woke up in a hospital bed, unsuccessful in her attempt to end her life.
There's all these things that contribute to your mental health all the way along your life. And I think there used to be this misconception that like pregnancy somehow protected you from all of that. And maybe we want to believe that, but it's just not true. And in some ways, I went back to look at some of the data when I was writing this. I actually started writing about my personal experience first. I really wanted to understand what happened to me. But then as a researcher, I sort of felt this need to both dig into the data and then also do my own studies to try to understand these patterns.
One significant finding being that Zivin's experience wasn't rare. In the U.S., 1 in 5 women are diagnosed with mental health disorders during pregnancy or in the 12 months after giving birth. And while many of us are aware of America's shockingly high rates of maternal mortality, what's lesser known is that suicide is a leading cause, according to recent research in the journal Pregnancy. Though Zivin didn't realize it until college, she'd been struggling with depression for a majority of her life, a probable driver for her career in psychology. Following her PhD in health policy, Zivin joined the inaugural wave of researchers at the nation's first depression center created by the University of Michigan. Though her research focused on mental health conditions, Zivin hid the fact that she'd been in psychotherapy and taking daily antidepressants for more than a decade.
Some of it's a stigma, some of it was credibility. I was an early career faculty member trying to get tenure, trying to have a job, trying to be taken seriously. I think if you're young-ish, women trying to establish themselves and trying to be respected and trying to have people think well of you, it can be hard if you're basically announcing that you've struggled with your mental health and even later, some of the cognitive impacts that my care had. It's not how you want to present yourself to the world, right? And yet, I think certainly some of the people that I didn't tell would have been supportive. I was really worried about the stigma, being judged, being disrespected, being discounted, not just during that time, but sort of forever on afterward.
Zivin's ongoing battle with depression was a main worry in the couple's decision to get pregnant. One she details in her new book, Persevered, a maternal mental health memoir. She married at 34 and felt pressure to have a baby sooner rather than later, without time to settle into this new stage of her life.
We didn't have years behind us to prepare for this moment, if that makes sense. And so, I think of what happened to me in this period of like this perfect storm. I had this history of mental health, but wasn't sure how it was going to play out during pregnancy. I was newly married. I just bought a house. Became a stepmother. I was trying to get tenure, all these different things happening all at once that really contributed to what ultimately ended up happening.
Like many women, Zivin decided to stop taking her antidepressants when she got pregnant. Though it's a common suggestion by healthcare providers, Johns Hopkins Medicine reports that antidepressants have not been known to cause birth defects. In fact, disregarding the mother's mental health during pregnancy can be riskier than the perceived threat of continuing to take medication. In Zivin's case, the rapid decline of her mental state happened pretty early in her first trimester. She says the main driver was a lack of sleep.
Like most people, even if you haven't had mental health conditions, if you string together enough days when you're barely sleeping at all, it really takes a toll. In some ways, to me, the insomnia was worse than the depression. And I didn't anticipate having that in my first trimester. Like I assumed that, towards the end of your pregnancy, when you're sort of larger and uncomfortable, and all of that, I could sort of picture that. But it happened really early on. And that really affected my mental health, especially because I was trying to work. I had a lot of pressure.
It became clear that Zivin needed professional help, and though she was surrounded by some of the best mental health researchers at work, she didn't want them finding out and risking her professional reputation. Instead, Zivin made a therapy appointment at the Depression Center under a pseudonym.
It was, like this made-up name, and it was almost like, okay, celebrities have that when they're, like on the rest cure in rehab, and I mean, in some ways I asked for it, in some ways I wanted it because I was being treated where I worked, and that was pretty awkward, especially because this was for mental health. This wasn't for like cancer treatment.
On that first visit, Zivin sat in the corner of the waiting room, hiding behind a potted plant in case any of her colleagues walked by. Even as a mental health researcher, Zivin still felt the enormous weight of the stigma so many experience.
We don't have the same kind of stigma if you have diabetes or cancer or heart disease. And I think there's this sense sometimes of blaming the victim of like, it's almost like your fault. If you just had a better attitude, if you just tried harder, if you just took resilience training, that somehow you would overcome these issues. And then particularly when you add on pregnancy and, women and trying to think about, this idea that pregnancy is supposed to be a time of happiness and well-being and joy, looking forward to the next generation and all of that kind of thing. And so if that's not your experience, it's particularly isolating, guilt-inducing. Why am I not feeling the way all these other women around me seem to be feeling?
Despite mood disorders being so common during this time, Zivin says many women can feel like their symptoms are being dismissed by providers as just another thing to deal with during pregnancy.
In general, we don't focus a lot on either women's health or mental health. So then when you bring those together of like women's mental health, it's not really a public health priority for a lot of people.
As Zivin tried to continue juggling all the components of her life, the original plan of managing her mental health through talk therapy wasn't slowing her descent into a deep depression. She restarted medication, but her condition continued to rapidly worsen no matter what her doctors tried.
It was severe enough that it was going to be hard to figure out what to do beyond what they were already doing, which was, monitoring my medication and trying to stay in touch with me. Obviously, I wish I made different choices. And yet it's hard to know, would my health have declined regardless of some of the choices I made? I don't know. I never had another pregnancy quite intentionally after that experience.
That's not to say that this is every woman's experience who has a history of mental illness. In fact, Zivin's heard of numerous women who had similar challenges in their first pregnancy, then used that awareness to better support themselves through their next pregnancies. Though Zivin's book is a memoir, it's ultimately a case study on a side of pregnancy that's rarely talked about, complete with scientific research and notes from her own doctors. It's a life raft for women who may be silently suffering, thinking that they're the outliers, the defective ones.
And I'm trying to use what I learned and what I did to help because if we're all sort of existing in our own little ecosystems of silence, then that doesn't help people. I think there's a whole community of women that have had this experience and also go on to bond with their children, recover, have good lives. It's not a, lifelong sentence, but that it really is common. 1 in 5 women go through this. And so just being mindful of that, I think could hopefully help at least some people.
Zivin's book, Persevered, is available now for pre-order. You can find more information about Dr. Kara Zivin and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.